you. Thank you.
Tonight, we're talking to Corlis Taylor and her bio as it appeared in the Summer Sessions program for this. Corlis Taylor is a longtime Alaskan who worked in public health in Bethel and Fairbanks, helping operate one of the first centers to aid domestic violence and sexual assault victims in rural Alaska. She moved to Fairbanks in the early 1990s and worked at Fairbanks Memorial Hospital for the rest of her 40-year healthcare career, while also diving deep into her passion for fiber arts and quilting. Taylor has continued to teach quilting and fiber arts through the Cabin Fever Quilters Guild and the Radical Alaskan Garments Society, a group that she co-founded in 1991. She's also remained active in helping with the issues that she spent her healthcare career dealing with as a board member for groups such as the Arctic Resource Center for Suicide Prevention and the Center for Safe Alaskans. Hi, Corlis. You first came to Alaska in 1979, but what was life like for you before you got here? You know, where did you grow up?
Well, my dad was in the military, in the Air Force, so I lived all over the country and in Europe. And so it was time to go off to college. I went to the University of Wisconsin in Madison. And when I was graduating, I thought, now what? I have to make a decision about where to go in this world because I knew I couldn't stay in Madison. There were 40,000 students, you know, probably, I don't know, a lot in my graduating class and everybody looking for a job. So as much as I wanted to stay in Madison, I knew it wouldn't really be possible. So, but then I didn't know where to go. While I was in college, my parents had gotten transferred to Orlando, Florida, Orlando Naval Training Center, even though he was in the Air Force, but anyway. And so it was like, what do I do? And so there was a action office, a national recruiting office in Madison for Vista Peace Corps. And I thought, I'll join the Peace Corps because then I don't have to decide where to go. All my life, no one decided, you know, it was like, oh, here's your orders. You're going to California, you're going to Germany, you're going to Oklahoma. So I thought, there you go. Somebody will decide for me where I need to go. And so I had my interview, signed up, did all the paperwork, and then, you know, I'm on campus. People are like, what are you doing when you graduate? And I'm like, oh, well, I'm joining Peace Corps. And they're like, oh, wow. I had a friend that was in the Peace Corps, and they were in the Philippines, and they had rats this big. And I'm like, oh, my God. And then, you know, I run into somebody else, tell them I'm joining Peace Corps, and they're like, I had a friend that was in some country in Africa, and I can't remember what that problem was. But the kicker was when I told somebody, you know, I was going to Peace Corps, and they said, I had a friend and somewhere in South America, and they got some weird disease, and they came back, and all their teeth fell out. And I thought, okay, that's it. I went back to the office and said, I cannot join the Peace Corps. I can't tell you why, but I can't. I know I'm not tough enough or strong enough to do that. And so I'll do Vista. And I will, you know, be in the United States or U.S. territories. And then you had first, second, and third choice of the region. You know, so the U.S. is in 10 regions for a lot of things. And so I thought, okay, well, I signed up to be, Region 8 was my first choice, which is like New Mexico, Arizona. I was keyed in to New Mexico because my cousin went to school at the University of New Mexico in Albuquerque, and I'd gone to visit her, and I thought, wow, this is a cool place. So I thought, oh, I can go to New Mexico. She's still there. This will be great. So Region 8, first choice. Region 9, which is California and Nevada. And then Region 10 is Washington, Idaho, Alaska. But I just knew, you know, I was going to be on the West Coast, and that was great. And then when I got my letter in the mail saying I was going to Bethel, Alaska, I'm like, what the heck? I'm like, oh my goodness. I told my parents, I'm going to Alaska. My parents just looked at me like I don't know, like it was, they were, yeah. And so I went to the library. My husband knows what library it is. It's right around the corner from my parents' house, and there wasn't a lot. I looked at a couple of National Geographics, and then I remembered my roommate that I'd had all the entire time I was in Madison was now in graduate school in Kansas. So I called her. I'm like, Kathy, they're sending me to Alaska. What do I do? And she's like, I have somebody that lives on my floor that's from Anchorage. I will ask him about Alaska and call you back. People who lived in Bethel know what. And so he informed Kathy, who informed me that there was no electricity in Bethel. And I thought, oh my God, this is just going to be like Little House on the Prairie. I'm going to be reading by lantern light. This is like, oh my God, what am I doing? And so came to Anchorage for training, and for a week with all the other Vistas. There were 90 of us total, about half Vista lawyers that worked for Alaska Legal Services, and the other half were, going around. I think there were like 8 people that came to Fairbanks and the surrounding areas, and a lot went to Dillingham. There were 4 that went to Juneau, and I was the only one going to Bethel, Alaska. There was a Vista lawyer that was going as well. But they kind of separated us in Anchorage, so I didn't actually meet him until we were in Bethel. But so I quickly learned that there was electricity, and I couldn't figure out what that guy was talking about until I learned. So I moved there in 1979, and I quickly learned, because people were still talking about it, the year the power plant burnt down. And so there was no electricity in Bethel. And that's probably what he remembered, because it was just all over the fact that, the power plant burned down. So they had the national, and it was the winter, was what time of year was that? December, yeah, so it was cold. So the National Guard is flying out generators and all kinds of things to kind of keep the community going until a new power plant could be built. But that's what people were talking about, and I thought, that's it. There was no power for a short period of time or a long period of time.
So you got to Bethel in 1979. What was it like for your introduction to Alaska to be in a community off the road system with power, thankfully?
Well, I had decided early on, once I had my training at the federal building where we had to swear allegiance, the whole big ceremony, and they talked, it was just an orientation to Alaska, and they talked about people that were going out to the rural areas, how they just told all these stories about people who landed where they were supposed to be assigned to, looked around, and got back on the same plane and left. And I thought, I'm sitting in this room with these people, and I'm thinking, that is not going to be me. That is not going to be me. I'm going to stay the entire time, no matter what. So I already had that in my head. So when I got there, it was very different than Orlando, Florida, and Madison, Wisconsin. And I lived in a place that had a honey bucket. We had no running water, we had running water that was delivered into a tank that was in your house. That first winter was kind of hard because it was so cold for me. And I remember wearing 4 pair of socks inside my Sorels and walking to work, which was at the Tundra Women's Coalition. And it was, but at the same time, even though, working through all that, I knew I was going to be there. So I just kind of jumped in. I worked at the shelter and did some volunteer work with the hospital, and because my degree was in public health, so I thought I would be in public health or doing some health thing. Little did I realize that domestic violence and sexual assault is also public health. It just didn't occur to me because that just wasn't a part of my it wasn't in my realm of knowing that those, I mean, I was 22, 23. It wasn't in my realm of knowing that those things happened. So that was a big, I learned a lot working at the shelter. Robin Barker, who's here, was one of the people that wrote the grant for the Vista to have a Vista come. And so she was one of the first people that I met and one of my first fast friends, and she's here. And so we've been friends for 47 years. We all ended up here in Fairbanks from Bethel. So so I had a great year. And I told my family, I'm going for a year, I'm staying, I won't be home for Christmas, I won't be, because I couldn't afford it. As a Vista volunteer in 1979 and 1980, you got $400 a month. And with that, everything came out of that. My rent, my food, taking the taxi when it got too cold, and I didn't feel like walking. But yeah, everything came out of that $400, and somehow I managed to do it. Although in November of that year, when they brought us all back to Anchorage for an additional training. I think it was mainly just to get everybody together, especially the people that were in far-flung places. And people were like, yeah, so how are you managing, blah, blah. And somebody said, oh yeah, I signed up for food stamps. I'm like, food stamps? So how do you do that? So, as soon as I got back to Bethel, I was at the office signing up for food stamps. And I think I got something like $90 or $100 a month, which was a huge help, especially there because the food was, is so expensive out there. When I moved, after being there for 12 years and moved to Fairbanks, I thought, I cannot eat another piece of broccoli. I can't have a potato, because those were, those hardy vegetables were the vegetables that you could buy at the store. Avocado, what's that? Asparagus, what's that? Unless it's in a can. But everything was so expensive, so that $90 was like, oh my gosh, that was amazing.
You've kind of alluded to what you did as a Vista volunteer, but you worked serving domestic violence and sexual assault victims, in a rural community, which was kind of groundbreaking work at the time. There really wasn't much of that going on. What was that like for you, and I guess how did you cope? It seems like it's heavy work.
Yes, it was heavy work, especially when you were learning about it for the first time. And it was just, the shelter, I think, started the year before I got there. They had just moved into this Quonset hut that there was a group of women that started the program who first started off with having safe houses. And then they kind of, I don't want to say browbeat, but they really kind of beat up on the city council about needing a building. And so they said, oh, what the heck, we'll give them this old Quonset hut. And the group of women, including Robin, when I first, she had a tool, she'd come in there, at least once a week with a tool belt on, because there was always something that needed to be fixed. She was one of the primary people that, had to build the floor, build the rooms, everything. And so it was, there was the executive director, there was me as a Vista volunteer, and then we had 10 CETA workers, which was a government program at the time. Most people probably don't know what that is, but to hire people to train them for jobs, train people for jobs. And that was our crew. And so it was heavy lifting. And again, we were in this Quonset hut that we had a bathroom that consisted of a honey bucket. So think about working at a job, a business that served people, and all the employees and the people staying in the shelter were using honey buckets. That every week, so every day that doggone thing was practically practically full. So somebody, rock, paper, scissors, is elected to, because the bathroom was in the back of the building, the front of the building, you'd have to take the bucket out and sit it in the porch for when they would come by and pick it up. The honey bucket truck. And you didn't want to miss when that truck came because so it, and we didn't have running water there. We had dip water. So it was in one of those giant garbage cans with the lid on it, and they would come and fill it with water, and we had a ladle. So it's like we called it dip water. It was, people either had running water that was delivered in a tank in your house, or you had dip water. And we had dip water at our work. So I would alternate with the other staff and doing shelter nights. So when we had women staying there, we would have to stay there with them. So I slept on the couch many times there at the shelter. And that spring, so I'd been there maybe 7 months. And part of what I did too was I got an opportunity to travel to see what the other shelters in the state were doing. So I had gone to Anchorage and saw the shelter in Anchorage, spent a week with them, went to Juneau and spent a week down there. And they were all like fancy, or what I called, people in Anchorage probably, and the people that worked there probably didn't call it fancy, but I called it fancy because they had bathrooms and they had running water. So that spring, when that was time to submit for the state grant, there's the domestic violence, sexual assault, what do you call it? It was just getting started. That's why I can't remember the name of it, because it was just starting. It was only in the first or second year. Council on Domestic Violence and Sexual Assault. And that year, everybody, submitted how much money they wanted for their program, goes to the governor. Of course, the state has this much money, and we asked for this much money, which was way more. And so instead of the governor, who was Jay Hammond, instead of him redlining or saying no to things, which I thought was really great, he brought all the executive directors into Juneau and said, you guys need to come up with cutting, I'm going to give you this much money, so you need to cut to get to this number. And so let's say it was $1 million. I don't know what it was, but $1 million, and they're going to give us $900,000. You have to make the cuts among yourselves, and let me know. So my executive director was on vacation. So I went. And so I am in Juneau in the governor's conference room with the executive directors from the shelters around the state, Kenai, Anchorage. And Anchorage had the shelter, and then they had the Alaska Women's Resource Center, Juneau, all, and so we're all sitting around the table, and somebody took over the lead of that and said, okay, we're just gonna go around the room and everybody say how much you're willing to give up. And I think I was in the middle of that group of people, and so they kind of go around. And they got to me and I said $1,000. People are giving up, $50,000 here. I can't remember how much we had to come up with, but it was significant. And everybody kind of looked at me and wanted me to give up. I said, no, $1,000. And they said, okay, well, we'll come back. So, they went around and they added all up, and we still needed to come up with, I don't know, another $100,000. So we went around the room again, and I think I said $100. I'm like 20, at that point, I think I'm 23 years old. All I knew was they had bathrooms. That's what I had in my head. So when everybody started ragging at me about, what are you doing? Everybody's giving up money. You guys need to give up more money, blah, 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 blah. And I just said, no, I don't. We don't. And I kind of launched into this thing about, you guys have running water and bathrooms, and I'm trying to explain to them what it was like being in a Quonset hut, trying to take care of women with dip water and honey buckets. That first few months I was in Bethel, I got hepatitis, and I know it was from that doggone honey bucket, you know. And so, you know, I just stood my ground, and we left with maybe only giving up $1,500. So, when my boss came back from vacation, I guess her phone had been, that first morning, she was at work first, and I came in, I'm like, oh, Jackie, you're back, I'm so happy to see you. And she says to me, what did you do? My phone has been ringing off the hook I've heard from Karen and Juno and so and so and so. And I'm like, well, this is the way it went down, and I don't care. So yeah, so that was what my first year was like. I made my best friends, Cheryl and Robin are sitting there, and a couple of other people aren't here. But yeah, they were we did all kinds of things together, and they were all at my wedding, and, you know, they helped me when my daughter was born. I was there when Eric was born, and just, you know, just really close, good friends. And then they all left. They moved to Fairbanks, and it was like, oh my God, what am I gonna do? These are people I'd spent every holiday with. They'd been at my wedding, my daughter's birth, you know, just everything. We did everything together. And I was just distraught when they left. Cheryl was leaving. She was the last one to leave, and she said, I remember at her house, and she says, I don't want you to come to the airport. Because I knew she thought, you know, we would both be too sad. But anyway, and then maybe a year and a half or 2 years later, my husband comes home and says, so I have the opportunity to work. So he worked at the hospital. I worked at the hospital in Bethel at this point. He was at the eye clinic, and he came home and he said, Tanana Chief Andrew Isaac is looking to open an eye clinic. They don't have their own eye clinic, and I have the opportunity to go there. And I'm like, oh my God, I can't believe we get to go to Fairbanks where all my friends are. And so it just worked out that we all ended up here, and still doing all the things we did when we were in Bethel.
That's terrific. So as you mentioned, you came here in 1991, and what was your job? You know, your husband was Chief Andrew Isaac. What did you end up doing?
So I had to quit my job, and so I came here, and I thought, well, I'm just gonna lay low for a while and figure out what I want to do, because our daughter she turned 6 the summer we moved here, and you know, Bethel was just a really different place. You know, the kids kind of ran free. You know, it's very native culture for kids to just be kids. And so she's 5 years old. She's going to the park across the tundra, you know, from our house with her other little friends. And it was that's just what you did. And if you're like, I wonder where Michelle is, you call somebody down the street and they're like, oh yeah, I saw her with so-and-so and so-and-so, and they're over at, you know. And so when we moved here, I thought, I got to put a leash on this kid. And she's not used to that. So I didn't work for the first several months we were here. So we moved in the summer of 91, and in 92 I was with some friends, and one of them said, there's a job at the hospital I think you would be perfect for. So I applied for it, and there was someone from New York who applied for it, and some other places, and I got the job. And it's really funny because about, 10 years later, I didn't know who that person was. I just knew she was a nurse from a hospital in New York. And about 10 years later, I am at a wearable art conference in Santa Fe, New Mexico. And I met this woman there, and at the end of the conference, we're waiting for the bus to take us to Albuquerque to fly our various directions. So we're sitting there waiting for the bus, and she says, "Where are you from again?" And I said, I'm from Alaska, Fairbanks, Alaska. And she said, "Oh yeah, I've been to Fairbanks." I said, "Really?" She said, "Yeah, I applied for a job at the hospital." And I said, "What job did you apply for?" She said, "Education department manager." And I'm like, "Oh, okay," which was my job. So yeah. Oops. But it's funny how things, you always have those interactions or things that happen that make you realize what a small world it is. I mean, Santa Fe, New Mexico. 10 years later, I meet the other person who applied for my position. So, yeah.
You mentioned being education manager for the hospital, and there's a lot of health education that we sort of take for granted these days that was not common knowledge back then, like the effects of secondhand smoke, or the fact that kids in cars should not be in the front seat and maybe be in a car seat, that sort of thing. What was it like helping lead those education efforts at a time when people weren't kind of on board with that necessarily?
Yeah, so my degree, I have a master's in public health, and so working at the hospital, I loved my job. I just absolutely loved my job. And part of the reason why I think I loved it is because I got to do so many varied things. I managed the cancer navigation program. Actually, I was one of the people with another nurse who kind of started that program. And she came to me and she said, "Okay, I think we need to go for certification for Breast Cancer Center of Excellence." I'm like, "Okay." And so we worked for about 3 years to make that happen for the hospital to get accredited for breast cancer. And so I did that, and managed the nurses, one of who's here, Molly, with doing nursing education. So when we hire new staff, they come to our hospital, and a hospital is a hospital, but not. They all have different equipment, et cetera, et cetera. And so when people were first hired, they would have orientation, to our hospital and our policies and our procedures. And so we did that. And then, one of the community education programs was the child passenger safety. And so someone from the manager for the emergency department at Providence came up and said, "Okay, we have this Safe Kids program, national program. We have it in Anchorage at Providence through the ER. We think Fairbanks, is a big enough hospital. You guys should have a program here." They talked to our boss at the time, and he's like, "Corlis." And so, so it started the Safe Kids program, got it accredited. It's a program that's based in Washington, D.C., so got accredited to do that. And one of the first projects was getting kids in car seats, because there were just C. Everett Koop, who was the Surgeon General at the time, is famous for saying, because there were so many kids that were dying in car crashes, he was famous for saying that if a plane crashed every day, people would be up in arms and demand that something be done. And yet we have children dying every day in car crashes, and we need to do something. So he was a real, and that's public health again. And so that's when the child passenger safety program started, and Safe Kids kind of nationwide led the effort in that. And so we jumped on board here in Fairbanks. At the time, General Motors had gotten in trouble for, I can't remember at the time what happened with some vehicles. And so they got fined $10 million. And that money got given to Safe Kids in DC, who then dispersed it out, and that's what started the Child Passenger Safety Program. And so the hospital has a really robust program in that. They still have it. The person I started with doing that, I contracted with her because I started doing it and I'm like, oh my God, I've got the cancer program, I've got nursing education, I've got physician continuing education, plus, it was a grant, so I'm writing this grant every year. I'm like, oh, I need some help. And so I contracted with Angela, and she's still there. Actually, I just met with her earlier this week. She came by. So she works with preemies in the NICU. And so it's still a very robust program. And it's fun to think that I was on the cutting edge of that. There were not certified child passenger safety technicians, and so Safe Kids kind of wrote the program for getting a certification, kind of developed that program. And then they brought us all to Orlando, Florida for the first certification. And you have to recertify every couple of years. And when I retired, that was one of the things, you retire and you kind of give up on things that you spent so much time working toward. And when it was time to renew my certification, you have all this stuff you got to do. And I thought, I hated to give it up, but I decided I needed to give that up. But yeah.
Another thing that's fairly common practice now, but wasn't then, was the ability for Alaskans to participate in clinical trials for experimental medications. What was your motivation for moving forward with that as an area of focus? There had been a program at the Cancer Treatment Center for people to be on clinical trials, but that person left. It's so involved. I can't even explain to everybody how involved it is to have your hospital participate. It's not just a matter of calling up and saying, yeah, we want to be able to do clinical trials here. I mean, there's just a lot of hoops and things you have to jump through. So because we were, Commission on Cancer certified, Cancer Center, we got certified for breast. And so we decided that we needed to do clinical trials. And so we embarked on that. I hired somebody to spearhead that, to shepherd that program, I guess you'd say. And, working with the surgery department and radiology and just all these departments that are involved in taking care of cancer, business office, because there's this whole thing with billing and not billing when people are on clinical trials, and so many meetings about stuff. I'm like, what? I don't know anything about insurance and charging people for things and this and that, and all the just so many things. But we decided it was important to be able to offer clinical trials to people who live here in Fairbanks who find themselves with a cancer diagnosis. And the feds realize that too, because most clinical trials are happening at the big major medical centers, Mayo Clinic and Cleveland Clinic and, Johns Hopkins. And so a number of years ago, they wanted to make clinical trials available to rural areas. And so they started a program where these major medical centers, smaller community hospitals could tag on to major medical centers. They had the major task of having clinical trials, and we kind of lobbed on to them, these smaller rural areas, kind of, not to say there wasn't a lot we had to do, but they carried the bulk of the work. And so for us, we were tied in with Virginia Mason, Region 10, Virginia Mason's clinical trial program. And so they did all this stuff to make sure that they met the federal regulations, because there are a lot of regulations. And then there were some things that we had to do our part so that they could say, yes, they're doing what they need to do for us to stay certified to be able to offer clinical trials. So so we worked through Virginia Mason. I had a full-time nurse who was in charge of that.
Yeah, so we offered, we worked with Dr. Shahada with radiation and the Coxes, and, there's a lot of things you have to do to see if somebody's eligible for a clinical trial, but once they met the eligibility, then tying them into the appropriate trial. And I think I talked to you about one of the nurses in our department who we had a patient, so the American Cancer Society has this thing about, when birthdays, having birthdays, and also it's like what goals do you want to have? What, if you're a cancer patient, what's out there that people would say, I want to be around for my daughter's wedding. I want to be around for my son's graduation or my grandchildren's this or that. And so, that's part of what the physicians work to, especially if someone's terminal, to keep them alive so that they could reach those things that they want to do. And so we had a patient, I can't remember what, I just can't remember what it was, but, and so nurse Hannah was working with that patient, and so she's like, with Dr., I can't remember if it was the Coxes or Shahada, there's this perfect clinical trial we want to sign him up for, but the insurance company's kind of balking about it. And, I can't get them to agree to this. And I said, well, just, keep at it. So she called them like several times a day, every day, and I think, I don't know, I can't remember the time frame, but maybe a week they kind of gave up because she was not giving up. And he was able to participate in that clinical trial. So I was just that was such that I remember the two of us kind of jumping up and down in my office when she came and told me. She's like, oh my God, I got it, and so I nominated her for Nurse of the Year because she was just so tenacious about talking. I was in her office once and she's like, to the insurance company. So, yeah, and she won the award. We all went down to Anchorage. It's a statewide thing, and yeah, it was just so great when she won. I was so proud of her.
Did the patient make it to whatever milestone
yes,
it was?
They did. They did. He did.
Beyond your healthcare career, the way that many people in Fairbanks know you is through your passion for quilting and wearable art. And how did you get into that?
So that first year in Bethel, when I said, I'm going to be here for a year no matter what, winter came and I thought, oh, I got to figure something out. So that's when I decided I was going to teach myself how to quilt. I was already a sewer. I worked at a fabric store when I was in college for my spending money. And so I was a garment sewer. But I didn't quilt. My grandmother's quilted, but I really wanted to learn. So on one of the trips to Anchorage with Vista, I went to the book cache. I don't know if you've been in Alaska for a while, the book cache, the yellow on Fifth Avenue. So anyway, I went to the book cache and bought a book on quilting and brought it back to Bethel and figured it out from reading the book. And I made a quilt. And then somebody, oh, look what I did. And somebody's like, well, it was somebody who was one of the volunteers at the shelter and said, well, can you make me one? And I'm like, yeah. So I did. And then I made a couple other things and somebody said, okay, now you're ready to teach the rest of us. And I'm like, I better read this book really fast. So then I made like 4 or 5 things and taught my first class. And then we were off. And then after a while, somebody said, okay, somebody moved, Margaret, she moved to Fairbanks. To Bethel. She had lived in Wisconsin, was a big quilter. And she said, now we're ready for a guild. So she and I started the Quilt Guild in Bethel. And we met once a month. At the Fish and Game, Fish and Wildlife. They had a really brand new building and they had a great conference room. and one of the spouses, she said, yeah, we could use the conference room at the U.S. Fish and Wildlife Building. So that's where we met, and just that's what started me on quilting. And then I moved to Fairbanks, and the first summer I was here, I went into the local quilt store, and there was a garment hanging, and someone was coming from California to teach this wearable art class, and I thought, I want to do that. I didn't even have, not all of our stuff was in boxes in the basement of Tanana Chiefs because I mailed, I shouldn't say we, because James Taylor had, I keep pointing at him, had already moved to Fairbanks. So guess who's packing up? So I mailed 200, I think it was like 210 boxes to Fairbanks, and then we shipped some things air freight. So I didn't have any of my stuff. And so somebody loaned me a sewing machine, and of course I had to buy fabric, and took that class, and I was off.
Where has your art taken you in both the literal and metaphorical sense?
After a few of us were doing the garment making, then a couple of us were like, we need to start a wearable art group. Elizabeth's here. And we started RAGS, Radical Alaskan Garments Society. There were about 15 of us, and we started that in 1991, which was the first year I moved here. And we're supposed to have a meeting tomorrow. We meet on the second Tuesday of the month, and have since 1991. And so that's been a great thing because we learn from each other, we do challenges with each other. And then one of the people in the group, Gail Hazen, she came to me about 25 years ago and said, I want to rent a place to have a studio, and I need somebody to go in with me. And I said, oh, I'll do it. And so we have rented a space to have a studio we've been together in a space for about 25 years, maybe a little longer. I can't keep track of it, but it's been a long time. And as Gail said, we've been together longer than a lot of marriages. Sharing a space, sewing together. And then she and I and another friend in California, we've submitted proposals to present at national conferences. So for a number of years, we were going to the Pacific International Quilt Festival, which is in Santa Clara, California, right across from Levi Stadium and Santa Clara Convention Center. And we watched that thing being built. And because we used to park over there where that stadium is. And then one year we went and they're like, where's the parking lot? Oh, they're building a new stadium. Anyway, and then about 3 years ago, we thought, oh, let's branch out from the West Coast. So we put in a proposal to do a fashion show at the Mid-Atlantic Quilt Festival, which is in Virginia. And we got in. And so this last winter we thought, well, let's do it again. We're ready to do something again. So we wrote a proposal, the title of our program, to do a fashion show at the Quilt Festival in Virginia again, Mid-Atlantic. And our proposal was, the title of it is, It Started with a Button. So, we're challenging ourselves, the three of us, to make garments where our inspiration or our idea derives from a button. We have all these really great, some new, some antique buttons, and so it started with a button. So that's in March of 2027.
Speaking of fashion shows, you're the first person this year to have brought props with you. Are there anything you'd like to share about the pieces that you brought?
Yeah, so these are some recent things that I've made and some old favorites. Oh, God. I want to say Mrs. House, Eleanor, because she was my daughter's teacher at Pearl Creek, is wearing one of the pieces that I made. I don't even remember making it because I do sell some things, and so this is something that she bought with some hand-woven fabric. I didn't weave it, but yeah. And the piece I'm wearing is made with African fabric. I have quite the collection of African fabric that I've purchased when I've gone to these quilt festivals. And so I decided that I just wanted to make this garment that had bits and pieces. I hope I can stand up with all my wires and things. I don't even know where, is this in my pocket? Yeah, sorry. I've got 2 microphones on, so. So this is a piece that I made last year that's just all different types of African fabrics. And this is like one of my, well, I've got 2 here that are like my all-time favorites. This is also made with, so in case you didn't know, I'm a turquoise person. And so I had this piece, I didn't have very much of it, otherwise there would be more of it in the garment, of this African fabric that I really wanted to use in a garment. And so I didn't have anything left from the piece that I had, just from using it, this little bit in here. So yeah, this is like a knee-length coat. And my other favorite piece is made with, I wear this a lot, so I was trying to decide if I should wear this or this or this, this or this. But I made this about 30 years ago, and out of Japanese ikat fabric. And so as the people, I love this fabric that's in the lining. So the people here that are sewers will know, sometimes you buy a piece of fabric and when you get ready to use it, you think, I should have bought the whole bolt, because you just like it so much. This is another, I make a lot of vests because when I was working, this tag is still hanging in here from another show. When I was working, my wearable art is wearable because I wanted to be able to wear it to work. Because while I was working, 40, 50 hours a week, I didn't have a lot of time to sew. And so if I was going to sew, I wanted to be able to wear it. And so I made a lot of vests because they were easy to wear to work. Although this is a recent one, I just made this one this past winter out with Japanese fabric. So I have a ton of Japanese fabric and African fabric. And these 2 things I brought just because they're fun. This is a favorite that I wear a lot because it's an easy vest to wear with some black pants. And this very colorful thing I made for a show that was last winter at the Bear Gallery when they were featuring like local artists, or I can't remember what the theme was, but it was something like that. And yeah. It's kind of wild and bright, kind of like the one I'm wearing. But this fabric, all the fabric in here, except for the solid, is by one fabric designer called Tula Pink. And so she's, if you're a sewer or quilter, everybody knows Tula Pink. You know who Tula Pink is. And yeah, so she's on Facebook like every week talking about her fabric lines. And this is a piece that where I dyed the fabric. It's called eco printing, where you print from leaves. So this fabric was a white silk noil, it's called, that I printed leaves on and then cut it all up and mixed it with some other fabric to make this vest, which is the same pattern as the one you're wearing, Eleanor. I put a collar on it, a little collar, and yeah. But it's the same slit on the side, yeah. So, you can take one pattern and do all kinds of different things using the same pattern over and over again. I think I have about 4 vests made with this pattern because this is my favorite pattern. So people can come up afterwards if you wanted to look more closely at them. And then I have a coat that's made with some African fabric that's at the Bear Gallery right now. So every 2 years, the Quilt Guild has a quilt show, and it's hanging in there now.
When you were speaking just before we got started here, you mentioned Pacific fabrics, and immediately I was transported back to my childhood when I was about 5 years old and being brought there, and I did not appreciate it at the time. But thinking back on that, it seems like back in those days, there were more options in terms of locally sourced fabrics than there are now, and it seems like we're really in a kind of a desert state at the moment. Is it hard to source fabrics locally, or do you just have to know where to look?
It is a little different. Well, it's just not the variety because, we had Pacific fabrics. We had Cherry Tree. We had Two Sisters. They were in the Bentley Mall, I think. There was Sewer's Delight that was on College Road that everybody was like, Sewer's Delight? Because sewer and sewer spelled the same way. And people were like, it's a plumbing store. It's like, no, it's a quilt shop. There was Sewer's Delight. There was Snow Goose, which is the store that I taught out of. So there were a lot of options then. I'm probably even forgetting. House of Fabric. Yeah, so there was this, we had 6 or 7 fabric stores here in town. It's amazing.
Speaking of, I guess, changes over time, how has Fairbanks changed since you've been here?
Aside, one of the things that I always talk about is, for a town this size, there used to be a lot of places to go and shop. I'm putting that in quotes. You need a gift for someone. Oh, let's go here, let's go there. Or the fabric, you're looking for a particular thing. You're driving around town and hitting all the stores, and they're just, a lot of those have gone by the wayside. I think it's really hard to have a small business like that here in town when I think of the fabric stores that we have now, or store. Certainly we've grown, more buildings, but there seem to be a lot of empty buildings now, and there always seems to be a lot of construction. But I think the core of Fairbanks is still the same. We still, for the most part, have friendly people, people that are willing to help you. If you've got a problem, you can pick up the phone and, call your people. And if your people don't know, their other people know, you can still kind of do that. There's still lots of, I'm going to put a plug out there, lots of opportunities to volunteer for things. I worked with Alaska Health Fair for a number of years. Sharon's here. And now I'm on the statewide board for Alaska Health Fair because there's health fairs in other parts of the state. And there's an office here in Fairbanks and Anchorage, and we're trying to restart I was just at a board meeting in Anchorage last week, start the program in Juneau again. I'm on the board for the Summer Arts Festival. Tracy's here. Some of my peeps are here. I was president for a number of years, and I turned it over to Tracy, and she's like, why did you do that? But I'm still the vice president. So, there's lots of, then and now, lots of opportunities for people to be involved in things. When I hear people say, coming to Fairbanks or anywhere in Alaska, it's like, there's nothing to do. And I want to say, there's so many things to do and so many different ways to be involved in things. And all you have to do is ask, or, people, I'm going around now trying to get people for various boards, so look out. yeah, I mean, there's just so many ways to be involved in the community, and you know, being volunteering and being involved that way, you meet a whole new group of people. I don't think I really knew Tracy before we were on the board together, and it's like I think she's my good friend now because we've talked a lot on the phone about a variety of different things and taken some classes together through festival, and it's just she's a fun person to know. But I wouldn't have known her because we operate in different circles. You know, we have different work backgrounds, and but we have that in common now, and we do a lot with that. So, you know, there's lots of ways to meet people and get involved in things. You know, when you come to Fairbanks or any place in Alaska, you know, I love living here in Fairbanks. I married an Alaskan, much to my parents' dismay, because it's like I haven't lived at home or been, you know, except for going on vacations, which is Orlando, Florida is a great place to go for vacation, you know, since I moved away in 1979 when I was 22 and said, okay, I'm going to Alaska for a year. And they said, okay, we'll see you in a year. And my mom, you're not coming back? It's like, well, you know, I did my Vista year. I got a job at the hospital in Bethel. And I thought, oh my God, you know, $400 a month. And now they're paying me $20,000 a year. Yeah, I'm like, I need some money. I remember telling her I have to stay because I need to make some money so I can move back. And 1 year turned into 12 years in Bethel, and then, you know, Fairbanks. And
she hasn't said anything about the fact that she volunteered all over this community, to include Alaska Health for about 15 years before you ever got on board.
Yeah.
I'm maybe miscounting
Yeah, no,
years,
that's,
but it's somewhere close to that before you ever got on it, before you ever decided to go to the board.
yeah.
So, you know, she did a lot of that with a lot of places.
We're almost out of time, but before we go, you have one daughter, Michelle, who has followed a different career track than yours. In what ways is she similar to you, do you think, and in what ways does she differ?
She is so creative, but she's in marketing, you know, and for a lot of years she didn't see herself as being creative, but the things she does in marketing and the things I see from her and that direction, I'm just like, she's just so creative, and I think she gets that from me. And then it's so funny. My grandson is 4, so the next generation. And when I was there last week, he's a talker. I mean, he just, oh my, and so he was talking to me about, you know, and part of the stuff I can't even understand what he's saying. And so I said to my daughter, I said, oh my God, I said, Emmett is just, will talk your ear off. And she said, he has a lot to tell you. And I just thought that was just so, she's right. And so I thought, oh, wait a minute. I was going to start off by saying that I have a lot to tell you. And I thought, okay, Emmett, he comes by it, you know, from his grandmother. So yeah, but she's in Anchorage, and I feel really lucky that she's so close because, like I said, I was there last Wednesday because I had a board meeting. I'm on these statewide boards, and I get to go to Anchorage. I'm on another statewide board that allows me to do that too. And then we were there the week before, just kind of visiting for birthdays. And so I see her and my son-in-law and my grandchildren, you know, at least every month. They're coming in a couple of weeks, beginning of August, 3 weeks, I guess. So yeah, I feel very fortunate that she lives so close that I get to see her. And I get to see my other kids who live in Anchorage, Laurel, because I was around when she was born. Yeah.
Well, I think I can speak for all of us when we say we're very fortunate to have had this time with you. So thanks so much,
Oh,
Corlis.
thank you. And thank you, Michelle, for inviting me. I was so honored to be invited to do this.
I didn't realize you were a stand Thank you, and thank you, Corlis, for all you've done for all of us over the years. You inspired us. And yeah, it's just a joy that you chose to be here tonight. And we have some cheesecake. And anybody would like to join Corlis and Ben and Jim and enjoy the rest of the evening?
Thank you. Thank you so much. Thank you. Thank you. Thank you.
Question.
Yes.
Hi there. Last Tuesday I was in the room and Dr. Wren, cardiologist.
Yes. I know Dr. Wren.
And I couldn't, well, it's great he was here, but you had to be like a third-year biology student to understand what he was talking about. It was all from Latin papers. However, he said something that really stuck out. He is dependent on a new AI called open source.
Yeah.
Pardon?
OpenAI is the company.
Not open, it may be open AI. Well, I use a number of AIs. I've been off grid for 50 years. I still use 100. However, he was really big on this particular software. Now, you can't really use it unless you're medical or past medical. You have access to it. And I can give you my card, or just ask him. And ask, because he can explain a lot of it. But you want to look into this, because he says he uses, you can talk to it medically, or you can talk to it in common language. But it is profound. A lot of AI isn't. This is, and it will serve you really well in what you're trying to do, not just in medicine. So,
Thank you. Yeah. I see Dr. Wren from time to time. He's a fun person to talk to. I really like him. And he's, you know, there are several physicians at the hospital who are very much tied into the employees, you know, and we'll sit and have lunch with you, or, you know, what, you know, yeah. And he's one of those physicians who'll stop in the hall and say, hey, Corlis, and, you know, have a hallway conversation. So, yeah, I really like him.
Corlis, with the apparently large populations moving out of Alaska and these wonderful, great budget cuts that come at the federal level and at the state level also, how is that impacting all your volunteer programs and the programs that you run?
Well, I'm still I'm on the board for the Book Arts Guild, and so we just recently wrote a grant to the Alaska State Council on the Arts. So of course they have less money, you know, than they've had before. But you know, Alaska Health Fair, you know, actually at our board meeting we were talking about a grant that we applied for that we didn't get, but applying again for a second round choice in it. But yeah, there definitely is less money to go around for programs. I'm not sure, you know, about 10 years after I moved to Fairbanks, I didn't give up, but you know, I'd worked so many years with domestic violence, sexual assault programs in Fairbanks in Bethel, and on the board when I finished my Vista year, I was on the board for that program. And then I moved here and was involved a lot with that, worked with the physicians in the ER to write the policy around domestic violence for people coming in the ER. And but after about 10 years here, I haven't done that. You know, it's kind of like dog years. You know, if you're an empathetic person, it can be really hard working with those kinds of programs. So I'm not sure how those programs are faring, but that is, you know, state and federal money that supports the domestic violence and sexual assault programs for the most part, or at least then. I'm sure it's still the same. So yeah, it affects so many things. And certainly the hospital, oh my gosh. Yeah, I mean, I'm still in touch with a lot of people there at FMH, and yeah. Thank you so much. And you're welcome to come and look at anything or ask me any additional questions. Thank you.